Hello, viewer. Thank you for joining us once again on Youth County Projects Kenya. So today we have guests from Migori County who are going to share with us regarding the subject on whether adolescent and youth sexual reproductive health needs are being addressed during COVID-19 period. So joining me today is going to be Regan from Three-Way Care Foundation and the CEO there, Roy Frederick. So let me add Roy Frederick to the studio. Hi, Roy.
Hi to you, Violet. How are you?
Yes. Karibu sana. Welcome to the Youth County Projects Kenya platform.
Thank you. I'm already in.
Okay, Regan has disappeared from the stream, but when he manages to join, I'm going to add him again. Oh, let me add him. Hi, Regan. Hi, Regan. Can you hear me? It seems like Regan's. It seems like Regan's internet has issues. Okay.
Yeah, true.
Yeah. We can't hear you unless you go and use Roy's phone. Okay. So Roy, kindly introduce Three-Way Care Foundation so that the viewer may get to learn more about the work that you do.
Oh, Three-Way Care Foundation is a community-based organization. We have been working in Migori since 2016 in different line. Majorly, we are working in the court of AGYW, adolescent girls and young women in Migori County, in different areas. One of the areas is health, community trend issues, and empowerment issues. Yeah.
All right. And unfortunately, Regan, can you hear me right now?
Yes, I can hear you.
All right. So, Regan, kindly introduce yourself.
Okay, I'm Regan. I work as the project and I'm also a youth.
Aha. All right. But Roy.
Yes.
Regan is having issues with his phone. So
yeah, I realize that. Yeah.
Tell us more about the age group that you work with regard now to matter sexual reproductive health.
Actually, our main focus, we focus with the age of from 14 to 24. That is the age that we are majorly focused with. But the AGYW, the adolescent girls and young women, because the some adolescent girls and young women that are outside the school, some are still inside the school. And that's the reason we chosen that cohort to focus in, because that cohort, they face a lot of challenges, majorly in the community, during their life planning.
Okay, so we can't speak to Regan right now because his network is not clear, so he's not audible. Yeah. So I think the questions that we wanted to ask him, we are going to direct them to you.
Okay.
Yeah. So like during this time of COVID-19, do you think the sexual reproductive health needs of adolescents and youth have been addressed more so in Migori County?
Actually, that is the area that is neglected, being that the main focus now is on COVID-19, coronavirus, the pandemic, and being that is neglected. In Migori alone, we realized that even the graph of teenage pregnancy is going up, being that a lot of young ladies are dropping, a lot of young ladies are going to for early marriages, and many of them are getting pregnant. At the same time, the graph of HIV is rising up, and that is a worrying in Migori County. At the same time, the issue of GBV cases, the violence issues, it is something that if not addressed keenly or not look keenly, therefore after pandemic, we are going to start again afresh, dealing with the issue of teenage pregnancy, the issue of HIV, being that the new prevention is every day, the more new HIV prevention is being recorded. I witnessed even yesterday during the celebration of World Health celebration, there is a number of young people, and if you're not very careful, there, even in Migori alone, we are going to be in a bad place.
All right. So yesterday it was World AIDS Day, and what did you find when you participated? What are the statistics, the current statistics regarding the prevalence rate of HIV among adolescents and youth in Migori County?
Thank you so much, Violet.
Yeah.
Yeah, with regard to HIV, I think you know that according to government measures that people to stay at home and there's no school there's no school going on, only to Form 4s and the Class 8 that are in school, but the remaining group are still at home and are mingled with the young people, they are mingled with others, and even in Migori alone, you even find the lodges, the young people that are meeting with their in the lodges. And according to the statistic of yesterday, it was true that in Migori County we are in danger. If we are not, we are in danger because the focus is on the pandemic, and the HIV issues is rising every day because these people at home, they don't go for testing. They fear testing. There's too much of stigma and rumors, being that there is a new HIV prevention. But we are very happy that yesterday the new HIV prevention called PrEP came out clear, and the kind of briefing people, and people now at least are aware, people in Migori are aware about the new HIV prevention. So I can say that if we can do more sensitization on it, therefore we shall achieve if we can do more on prophylaxis, the new HIV prevention.
All right. Do you think behavior change programs are working in curbing the increase of HIV among adolescents and youth, and also, yeah, maybe you can first address that question. Yeah.
Yeah, thank you so much, Val. Actually, the issue of BCC, the issue of behavior change and communication is the key in Migori County. Because as you know, Migori County is one of the counties that is leading in teenage pregnancy. It is a challenge that we have here in Migori County, and we need to do a more sensitization on behavior change and communication and ETL, because it is a challenge to our people, young people in Migori, the youthage and the climate, we are faced. So it's a key in Migori County. We need to do more on sensitization or capacity building on behavior change and communication, because as you understand, these are our young people with their behavior. They every day, every time, and then they try to come up with different things. And if you don't understand them, if you try to talk with them and you don't get empathize with their shoes, that's how they feel like you are not of their type. And even the approach that we are using the approach of a young person speaking to a young person, because we realize it can work out well. Yeah, because if adult approach a young person, they feel that the adult is not of their age. So we are using the approach of a young person approaching a young person, and we talk with them, we share the story, and we advise them to go for youth-friendly services, including EG testing in the maybe our outpost point in Migori County.
Aha. All right. So viewer, the other thing I'd also like to ask is like with the rates of the increase of teenage pregnancy in Migori County. Family planning commodities available at the health facilities in the various sub-counties?
Yes, actually, we have to appreciate some of our partners in Migori County, that is the PIGO, under a Fialisi program. They have been doing what they can, being that now we can say that the commodity of family planning or of contraceptive method devices are available, only that the supply is not enough. The supply is not enough to the county, being that some of the sub-county hospitals, they still lack the commodities, being that you know that we have different commodities. Some you go to the facility, you only get the injection. Yeah, some even you go to the other facility, you get the long-term methods, but they still you find that to find a facility with all the commodities is not easy. But we have to appreciate the county government and some of the partners for the great work they're doing because they are really trying. Only that the challenge is the behavior change of communication of young people. There's still myth and misconception around the contraceptive methods that sometimes is making these young people to not go for these services. So we need to do a lot of sensitization so that young people can know the services are available for them.
All right. And do you work closely with the county government of Migori, more so the Directorate of Reproductive Health?
Yeah, indeed, we are working very close with them because without them, we cannot penetrate in the community. We cannot work in the community. So we are appreciating their support because they've been supporting us in terms, even if we are going to the community, because in the community, we have to use the CHVs, we have to use the charts, the community entry point, even the community gatekeepers for us to get young people in the community in different areas.
And are cultural norms impeding your advocacy towards ensuring family planning supplies are provided to adolescents and youth?
Actually, that is another key. Like in Migori County, you understand, it's one of the metropolitan county. We have a lot of culture, maybe like e.g., like we have the Kuria here. They have their own culture, and you find that most of them are not supportive to contraceptive methods because they feel that with the contraceptive method, sometimes they prevent these young people from not getting a birth, maybe. But indeed, real sense, young contraceptive method is just for spacing. So being that they don't understand the concept well, but I still feel that we need to do a lot of parental dialogue so that the information can get into the community. Yeah, those are one of the barriers, but we can still find a way if through the collaborative and working partnership together with the other stakeholders.
All right. And you is there is Migori County okay, let me rephrase the question. You still find even at this period of time, teenage pregnancy, the prevalence of teenage pregnancy is very high in Migori County. You also find that even the HIV rate is also very high, and yet there are so many NGOs who are working in Migori County to avert this crisis. Why is there increase in teenage pregnancy there, yet there are so many NGOs there who are doing their best to tackle this problem? And Bigori has been leading for several years. What are we not getting?
Yeah, indeed, we have a lot of partners, NGOs in Migori County. And as you understand that not all of them are focusing on the issue of reproductive health issues. And you find that some of the NGOs, they don't do the service delivery. The only thing they do the demand creation for the services. At the same time, you cannot ask somebody to go for the services. So the challenge that we are facing, no matter we talk with our young people, as you said before, there the issue of behavior change and communication is another key. You find that a young person will accept, yes, the NGO will do what they can, but even the parental dialogue, yes, we'll have. But the barrier here, you see, this thing is a willing decision. You cannot coerce somebody or you cannot push somebody to go for the services. So no matter they are trying their best, they're trying to reach the community with this information, but it's still a challenge because not everybody will buy in the concept.
All right, I'm seeing Regan has joined again. I don't know whether he can hear us.
Yes, I think Regan can now hear us. Regan can now speak.
Yes. So yeah. Regan, kindly share with us, like, are you working in one sub county in Migori County, or how many sub counties are your interventions targeting? Can you hear? I don't think
Regan
you
is
can hear us.
still.
I can hear you.
Can you hear us? Yeah, maybe.
Hello.
Yes. Have you heard my question?
Yes. I'm having a network problem, but I've rectified it, so I'm online.
Okay. Yes, we can hear you now. So,
Yeah.
how many sub-counties is three-way care interventions operating in?
Okay. Currently, we are working in 6 sub-counties. Yes. Can you hear me?
Yes, I can hear you.
Yeah, Three-Way Foundation, we are actively participating or engaging in 6 sub-counties out of 8. Yeah, so
Kindly
which we
share
are
more.
planning and okay. Okay, in Three-Way Foundation, we actively participate in 6 sub-counties, leaving 2 of which we are slowly all cadres or cohorts, adolescents and youth from all those sub-counties. Hello.
Yes, hi. But
You can
Roy,
hear.
maybe you can take over. Roy, you can take over and share
Okay,
on.
what the project going of Three-Way Care is trying to explain is that currently we already own 6 sub-counties in Migori County, but we are moving slowly to the remaining 2 sub-counties, in which I think probably next year we start rolling a full project in those sub-counties. That is what he's trying to say.
Oh, okay. So Roy, I'd like you to share like which donors are you working with at the moment?
Well, ideally, we are working with some of the NGOs within Migori County. One of them currently, sometimes back, one of them is PS Kenya, Population Services Kenya, in the line of new HIV prevention. Then on the line of contraceptive method, we are working with the Japaigo, and Japaigo under their program of Afialisi, where we are creating demand for contraceptive devices to the young people, and we are trying that young people to get services, the contraceptive services, at their comfort.
All right. Regan, can you hear me now?
Yes, I can hear you.
Oh, awesome. Kindly tell us more about the donors you are working with. Oh my.
That you're working currently in Migori County, we have different partners. We have different partners that have different interests in Migori County in the line of young people. One is Japaigo. Japaigo is a consortium of, it's a USAID program under Japaigo, which is called Afialisi. We are creating demand for young people to go for the contraceptive services at their comfort zone. At the same time, we are working the Population Services Kenya, where we are creating demand for new HIV prevention. Yeah. Apart from that, we have the county government too, is part of the donor that we can speak about, because they have been giving us the mandate of reaching these young people and by helping us with their staff so that we can go up to the grassroots level.
All right. So, Roy, thanks for sharing about the work that you guys at Three-Way Care Foundation are doing. Congratulations. And what is your message to the county government of Migori with regard to addressing the sexual reproductive health needs of adolescents and youth?
What I can tell the county government of Migori that you see the allocation for the budget allocation for the budget allocation for health is not enough, because you find that most of NGO are chipping in, And indeed, that budget allocation is supposed to be increased so that everybody can be served and everybody can go to the facility and get all these commodities at the facilities. At the same time, I will tell the county government to expand their wings in demand creation, not apart from demand, even capacity building to more of the community health volunteers so that the information and these commodities can get into the grassroots level. At the same time, I can tell them to invest more on the roaming provision initiative so that the young people can get the services at their comfort. Being that it's a challenge, these young people, they love when the services reach close to them. And if you don't take the services close to them, therefore, the issues of teenage pregnancy will just be high. If you're not very careful, the issues of HIV will keep on preaching it every day. So we need to do something, but we appreciate currently.
Awesome. And what message do you have for the national government of Kenya, Ministry of Health to be precise?
Yeah, actually, what I would like to tell the national government, that we need to, like one of the network, the 47 counties network, if they can reach the 47 counties network, Kenya Adolescent Youth Sexual Reproductive Health Network, and pump more resources, because we realize these are the people that can reach up to the grassroots level, and they support the county by releasing the allocation to go to the county government, so that the county government can plan themselves and they can budget themselves, and a lot of allocation can go to health. And the reason why I can tell them there is more needed, there is more of investment needed to the county department of health and even to the national department of health. Another thing I would like to tell the national government to involve young people, youth at the community level to even participate to the national level, so that they can share their views and they can understand what the challenge the young people are facing up to even the grassroots level, apart from the urban center.
All right. So thank you, viewer, for watching this particular show today on Youth Projects Kenya, where we delved into the subject of sexual reproductive health and whether the needs of adolescents are being addressed. Thank you, Roy, from Three-Way Care Foundation, for joining us today, representing Migori County. Thank you, Regan, also for joining. Unfortunately, Regan had issues with his network, so it was breaking. But at least Roy was there to fill the gap. So
but
thank you, Roy.
Thank you, Fred. You can say something. I see it on.
Yeah, anyway, so thank you, Fred. Thank you, Roy, for joining this broadcast. And it's always a pleasure to host you guys.
Thank you too. Pleasure too.
All right. So, viewer, we've come to the end of this particular show today, and join us this evening at around 5, even as we host a social entrepreneur from the western part of Kenya, who's going to share with us about the initiative that he has started there. So, see you at 5 p.m.